Welcome to Dr. Manamela, J.T.D, General Medical Practitioner. During this pandemic of Covid-19, I just want to take you through to what we do in this practice. We have partnered with pharmac pathologists, which are now called Pathcare. I'm going to take you through to what happens from the entrance until the screening and the testing and consultation. Come with me. This is our practice. It is at the crossroad of Jan Hrunki and Grafenheim. This is the medical practice. This is our board advertising. This is the information that we put outside when patients are parking. This is our notice that we inform everyone about the safety precautions and what they should do. As you enter, you find our healthcare professionals that are in the ambulance services under a wing of Dr. J.T.D Manamela. They work for the ambulances, ready queue. This is one baby for this practice. We have got one personnel that comes here. This is the PPE that we're currently using. They are masked. They welcome our guests. Every car that comes in and park, they welcome them and they start using a DGM and making sure that they wear their masks. They reinforce PPE as the tool in order for us to minimize infections. Now they would also encourage that before they get screened, they must all patients be wearing their mask, because we cannot screen or allow to see anyone without a mask. And we encourage them, because now that we've got some stock in the practice, to buy one before we can accept them to be tested or to be screened. This is another personnel. They are also 1 meter apart. That also has got DGM, wearing a mask, wearing face shield, wearing gloves, wearing an apron, wearing their boots, as you can see. And now they are holding DGM so they can spray any client that comes or any patient that comes through into the practice. This is another client with a table that has got all the screening forms to detect if we've got a risk or we've got a contact. They are using the DGM. They DGM every person that comes in. They DGM the pens. They've got their thermometer that they use to do the screening. And now these are the seats that are 1 meter apart. And now this is an ambulance. And now our testing center, once we have identified that we've got a risk and we don't allow anyone to go into the practice, they go straight into, follow this tract into the testing center where the Pathcare personnel are there ready for testing. For any other, after they are being screened and we have identified that we are not at high risk, now they are taken into this tent, which is our triage tent. So now in the triage, we've got a personnel. Currently, we've got a patient that is being triaged. There's a patient that is wearing a mask, was encouraged to wear a mask before we can do anything. This is our personnel that is also wearing their PPE. They've got the face shield, they've got a mask, they've got gloves. They explain to the patient what they are going to do, and everything gets done. After this station, now the patients are ready to see a patient, a doctor. I'm going to walk you through to the door entrance. This is the notice again. stating that you cannot enter here before being screened. This door remains locked at all times so that we enforce the possibility of patients not entering here before screened. And now once you are screened, you are given a go-ahead. The door will be opened for you. This is our reception. The notices are all over. We've got our personnel as well. We've got a spray to disinfect. And now we've got our receptionist as well that have worn their PPEs. They're behind the desk, and now they will assist you. And now currently there is one patient that is seated inside. We only allow one patient to enter the rooms at once. We don't allow to find that there's a lot of patients here. You wait outside, then you become helped one by one so that we can reduce the rate of infection. Here we've got our disinfectant in a fan that circulates in the practice. There's a chemical put in this system, and now there's a mist that keeps circulating in the practice to disinfect the whole practice, so that we are trying by all means they disinfect the files that are in the hole here, in the shelf here, and they disinfect and circulate in the rooms so that we eliminate any possible risks of the infection. Once they're done, they come to the doctor's room, they get examined. The doctor sits here, the patient will sit there at distance. The doctor will examine, try to take history, and assess if the patient doesn't have any risk of potential infection. And now the doctor will examine according to the doctor's discretion, to make sure that the doctor as well is protected. The doctor as well in this room where the PPE, the face shield is protected. There is no way the doctor can examine the patient without wearing this PPE. So at this point, the PPE is our most essential thing that we do. We also have got hand sanitizers. We sanitize every 2 to 5 minutes. We wear our masks and face shield. We wipe our surfaces every 2 to 3 minutes. We also, when the patient is in consultation with the doctor, she is also given, or they are given, a hand sanitizer as well every 2 to 3 minutes to sanitize their hands, so that we fight together this pandemic of COVID-19. I really would encourage that people come out there in numbers and come to our center so that they can be screened and tested, so that we can help our country in fighting together the surge of the pandemic COVID-19. I thank you.